How to become a talk show radio host as a physician leader. Do you want to know? Are you interested in becoming a guest? I have somebody who's done that on Sirius XM as a vascular surgeon. I want to talk to him because he's going to tell you a little bit about how it's changed his life. My name is Dr. Elsie Coe. I am the founder and CEO of Lead Physician Online Leadership Program for physicians, and I'll tell you a little bit about that later. But I'm also the Chief Medical Officer of American Endovascular and Amputation Prevention. Go to our YouTube video, see all our YouTube videos by typing in Lead Physician. Now, let me introduce to you our guest, Todd Berland. He is a talk show radio host. He's regularly on. He's going to tell you when and how to possibly get on if that's something that you're interested in. He is a talk show host for Doctor Radio, Sirius XM. And he's also the director of Outpatient Vascular Services at NYU. And we're going to ask him, what topics do you want to hear and what kind of physicians do you want to have on your show? I'm so happy to have him here. I'm going to bring him on right now. Todd, thank you so much for being here.
Elsie, thanks for having me. Always fun to do these things.
I know. I was so happy to be on your show. Now I have to have you on mine just so that we can get you out there even more. I mean, I'm sure a lot of people hear of you, but this is a physician leadership video podcast on LinkedIn. And we also are on Facebook and YouTube. So I want to ask you, thank you so much for being on here, but can you tell us a little bit about your story, how you got onto Sirius XM and what has that done for you and your organization?
Sure. No, thanks again for having me. It's always great to hear and be on things like this. Again, my philosophy is the more you throw out, the more that kind of comes back. So for me, being on something like this and certainly on Sirius XM was just another opportunity. And as a vascular surgeon, which by the way involves 5 years of general surgery training, well, that's the way I did it, and then 2 years of vascular surgery, I became a vascular surgeon. Was a regular guest host. I had been a guest host similar to how you've been a guest host on my show a couple of times. And then the vascular surgeon essentially left New York, and there was an opening, and Sirius XM people reached out to me and said, "Hey, would you like to be a host of our show? As you know, it's 6 to 8 a.m. live, and it has several other playtimes afterwards." And I said, "Let me get back to you on that." I asked my wife, and my wife said, "Absolutely not. You do too much. Don't do it." And I thought about it, and against her wishes, I replied to the directors there and said, "You know what? I'll do it." And it's no looking back. It's great. And I joke about that with my wife now. She essentially was against it because she thought I just did too much and it was one more thing. But honestly, it's 6 to 8 a.m. I'm done with the show by the time most people are waking up. So it's really no skin off my back. It's really fun to do. And it's created a lot of opportunities.
Yeah, you know what? You're really good at it, Todd. Did you know that this is something you wanted to do, or someone just recognized you from the start?
Yeah, no idea.
How do you become a talk show host? How do you get ready for that?
Well, thank you so much. My wife says I have a face for radio, so I don't know how this podcast is going to come out. But I had no idea. And honestly, I think anybody could do it as long as you're passionate about what you do. It's easy to talk about. The other thing that makes it easy, just as a physician, I always love relating to patients. So to me, that made it very easy. So I think the combination of knowing the topic of vascular surgery and then being able to have patients call in, they could actually send emails while we're live on the show. We answer their questions, just like when you're seeing a patient in your office. I'm being asked the same exact questions, but it's just a lot more people are listening. So to me, it's very fun. It's easy. And I never thought I would be doing it, but after being a guest host several times and being formally asked, "Hey, do you want to do it?" I said, "Sure."
Wow. How often does it get filmed does it get aired once you've recorded it with somebody?
So every recording gets 3 replays, which is great for people that I'm trying to promote on there, because not everybody's waking up at 6 a.m. to listen to this.
Right.
But it plays at like normal people hours, 4 to 6 p.m. later in the day on Friday, again 4 to 6 p.m. on Sundays, and then again on Tuesdays. Sometimes when there's a cancellation or it's a holiday, there'll be more replays, and those will happen weeks to months later. And sometimes I don't even know about those. I'll just get an email or random message when somebody's heard it online off hours. But each show is guaranteed 3 additional plays after the live play.
Right. And tell us how many listeners do you think listen to your podcast in general?
So no idea. Sirius XM purposely does not want to create competition among the different channels and certainly among the different hosts on the different shows. I'm the vascular surgery person, but they've got the weight loss show, the emergency medicine show, the sports medicine show, the child psychiatry show, and they're trying to not create competition within. So we really have no idea. We can gauge it by how many people are interacting at the time, how
Right.
the phones are going off, and how many emails are coming in, but you really don't know. I mean, I've never been the person to call into a show like that. So you always wonder how many more people are actually listening out there versus those that are just calling in.
Well, I know that when I was with you, people were calling in from multiple different, I mean, wow, like North Carolina, I remember somebody calling from anywhere. Like, how far have you had people call in from on your shows?
So it's very interesting. Sirius XM has satellites on both sides of the country, and little did I know until I saw the locations of the callers. People can call in from all of North America. It's not just the United States. We get calls from Mexico and Canada as well. As you can imagine, a lot of New Yorkers don't listen to Sirius XM. They have Spotify, they have their own podcast they're listening to, but a lot of America in between and west of New York, when people are driving to New York, as New Yorkers often aren't driving, we're walking, we're taking public transit. It's everybody else in the country and Canada and Mexico who's driving to work, who's listening to satellite radio. Those are the potential listeners. And one thing that's really given us a boost is COVID. For one thing, a lot of people turn to Dr. Radio as kind of a non-biased source for information. So I was always doing 30-minute segments on that. The other thing that really helped us out, there's something close to 140 million paid subscribers to SiriusXM. And
Wow.
one of the things that was interesting over COVID is they started just giving it for free in rental cars. So when you go rent a car, one of the 5 free stations you might get on SiriusXM is Dr. Radio. So I think people accidentally land on that show just because it's given to them when they're renting a car. So those kind of things have given the show a little bit of boost, but that's the long answer. The short answer is it's really North America and I would say mainly United States.
Wow, so awesome. So tell us how this has kind of changed your perspective on how social media can influence yourself, your personal development, but also how this has affected NYU and what you're trying to do.
Well, great question. What I love as a physician, and a lot of people don't think that, just being a physician is more than just seeing patients, kind of clocking in, clocking out. Obviously, we do procedures, we present at conferences, but when you add the social media aspect, it really opens things up. By having the show that's broken down into 4 30-minute segments, I'll have different experts on. And I really love it when it's a non-vascular surgeon expert. I sometimes do have vascular surgeons and we'll have some banter back and forth, but I hate the loaded questions. I hate asking about sizes to repair an aneurysm. I know the answer to that. A lot of other people don't, but when I'm asking a vascular surgeon, I kind of already know the answer. I'd much rather have a cardiologist on there, an interventional radiologist, a neurologist, where we could talk about stroke, and I could ask questions that I'm truly interested about, and that I feel the listeners are interested about to keep them engaged. So, it really comes down to being able to interact with other specialties. I haven't received tons of patients from it. I would say maybe 5 to 10% of my patients are listeners to Dr. Radio, which I guess some would say is a
That's
lot.
still significant.
It's pretty significant. It's
Yeah.
not as much as I would have thought. But when
Yeah.
I think about the percentage of New Yorkers listening to Sirius XM, it's not as much as everywhere else. But the best part and my favorite part is sometimes having industry liaisons on there and different physicians who work with industry, kind of talking about their latest device, talking about their pipeline. And it's helped me professionally because I've been then given the site PI or principal investigator for a new stent or a new ultrasound device, and it's kind of hey, I scratch my back, you scratch yours. I kind of get to promote them and the products that I'm really interested in, and then I get to be involved with the research and enroll patients in products that I really believe in to kind of advance the science. So it's really been fun on that level as well.
You're very impactful, Todd, not just from your, what you're just talking about right now, but I bet you're underestimating the impact you're making when you interview somebody across the country. A patient is listening, and they may not be able to go to you because you're just not in their area or in their state or maybe across the country. in North America somewhere, but you're making an impact by educating somebody on cutting edge stuff that people should know. Just like
Right.
with fibroid embolization, a lot of women don't know about fibroid embolization and they think that they need a hysterectomy. So I just kudos to you and what you're doing and bringing that to NYU. And I just love it. I
Yeah,
love
thanks
that
so much. And
physicians.
I'm looking forward to having you back on there talking about fibroid embolization because, again, it's one of these things that people don't just really know about it. But the more you can get it out there and somebody asks a question, if you could explain it in just plain, simple terms, you could get them directed to the care they need, whether it's in Kansas or South Dakota. They're at least getting that care they need.
Yep. Thank you so much. And Todd, I want to ask you, what kind of topics are you looking for? I know you're always looking for someone to be a guest on there, and I'm sure there's somebody out there listening right now on this podcast. What kind of guests are you looking for, and how can they reach out to you?
Excellent question. I'm always looking for things that are interesting and fun to talk about. Things that affect lots of people, I think, are more impactful. What Sirius XM wants are people engaged and listening, and they know there's certain topics that kind of get people calling in. You start talking about blood clots, varicose veins, aneurysms, leg swelling. Those affect lots of people, and so people will call in. And you start talking about a disease process that affects, 1 in 10 million people, that's super rare. While we can be physicians and geek out on that and talk about how that's interesting, that's not interesting to a lot of non-physicians. And the
Right.
show is geared towards the lay people. And so we want to talk and connect with people about something that might be going on in with their life or maybe a loved one's life, and not some
So
really
good.
rare random disease.
So good. Yeah. So how can people reach out to you if they say, you know what, there's something that I can help you out on and teach people about in my field?
Thanks for asking that. And any listeners out there or viewers out there, if you want to talk about anything that we could wrap around the field of vascular, and if it's interesting in medicine, I'll talk about that too. Just reach out to me, toddberland.com. On my website, I've got an email contact form. You could just reach out to me, and I'd be happy to have some banter back and forth. Of course, I don't like to have to promote industry, or if somebody has a financial gain. I'm certainly cued in on that and do believe as physicians we need to disclose that. Sometimes I have had the CEO of a certain company on, and I'm very careful to disclose that that person has a financial interest in this topic, but check out this really cool product here, and this is how it came about. But I'm really careful to disclose all of these. And certainly where I have a disclosure here or there, I make sure I talk about that, because as physicians, we have to really be careful about not leading people astray and making sure that our goals are aligned with what people thinks our goals should be aligned with. So to me, that's important. I don't just want to promote a company for somebody else to make a ton of money off a product.
Well, that's why they keep asking you to do what you're doing, Todd, because you obviously are a man of integrity and with ethical standards. So thank you so much for that and representing physicians in this front. You also mentioned that on Twitter at Vascular Doctor, people can find you, correct?
Yes, that's great. Yeah, vascular doctor, you got it. DR.
All right, great. Thank you so much for being on here. Thank you, everybody, for listening. If you have a topic on physician leadership, please reach out to me at info@drlcco.com. If you also or your group are interested in leadership training for physicians, check us out at leadphysician.org. Any last words of wisdom for us, Todd, as we close here?
No, I would just say as a physician, there's lots of opportunities, and some of them aren't even realized by you right now. I would just say don't shut any doors. Keep all options open. You never know where it's going to be, whether it's with industry, with media. There's lots of different options within the field of medicine. It doesn't just stop with the patient. It starts with the patient, but it doesn't have to stop there.
I love that. Thank you so much. Thank you, everybody. Until next Sunday, take care.